Hi, welcome to the August Board of Health meeting. I think we may have one person for privilege of the floor.
You're not here yet.
They're not here yet? Okay, great. So should we just move on until they get here? Okay. So I would like to make a motion to approve the July minutes as written. First from Ed, second from Shauna, all in favor? Unanimous. Okay, great. And so let's move on to the financial summary. Brenda.
Financial summary is included in your packet. And that is for July 2023. I really don't have anything to add other than the comments at the bottom. The large revenue for the public health COVID school grant, we are in the process of getting that from the state. They've had some questions and we've had to submit additional information, but we do expect that $634,000 to be paid shortly. And that will be the end of the school COVID grant.
Great. Any questions for Brenda? And Frank's not here. Is anyone, are you reporting for Frank too?
Frank is on vacation this week and next. And I don't have a report from him.
Okay, great. And Sam, how about health promotion?
Additional updates. We did just have a new community health first start. Who briefly was in here. Annie Marshall. So we're excited to have that team at full capacity right now, and she'll be working directly with the pitch program with her community health. So she just started yesterday.
Any questions for Sam?
So
I just wanted to ask about two things. I noticed that some of our COVID numbers are going up a bit. And was questioning how many people do you think the numbers that you're putting out, are people actually reporting to you guys or?
No.
Okay.
So no one is reporting to us directly anymore. That all the numbers on the dashboard are pretty much from New York State. I think we were reporting some CDC data as well, but I think it's just New York State now. And so, yeah, so they're just like results, test results that are coming through are, going to the lab, and the state is compiling that information. So it's still no reporting of like self-tests, home tests.
Okay.
Yeah, so it's difficult to
Sure.
know what the true numbers are because of that. Yeah.
I did have a question from a constituent as well about water testing and if we're testing the COVID levels in our water.
Like the wastewater.
Yeah.
So Liz or Rachel might be able to speak more to that, but there is a website and testing is happening. So Liz, anything else on that?
No, I haven't been actively monitoring it. The last time, well, I was also out on vacation. The last time I looked, it wasn't showing an increase. I don't know if this, but I mean, it was maybe slight, right? But nothing real significant. But it would be a good thing to look at.
But it's just on the New York State website, right? It's a public site about COVID-19 virus
We don't have a link on ours, right?
on our website.
Yeah.
To it. We should. I'll see if we
I
can
don't
get that.
know. We did.
I know it's come up, but yeah, it's publicly available.
Okay. Thank you.
And we have, is it 2 plants that are participating in that?
The Ithaca Area Wastewater Treatment Plant and Cayuga Heights, are the ones that are.
So not all of them participate, so.
Okay.
Yeah.
Thank you.
Yeah, that's most of them.
Yeah.
One other thing I was gonna mention is just that we continue to do a lot of like community outreach and going to different community events. So I just wanted the board to know that like if you ever have an event that you're connected to in the community or hear about something that you want to make sure that that whole health is represented and present, please don't hesitate to email me or my colleague Shannon. We're just doing a lot of that coordination for different programs to attend, and we do it jointly with your medical colleagues as well, which is great. So anyway, I just want to make sure that you all know you're well connected as well.
Okay, Dr. K is not here today, also on vacation.
He had, I think, a memorial service today for his mother-in-law.
Okay, and then Division of Community Health.
Hi, yes. I just got back from a week of vacation, so not too much to add to my report. We're also in process of hiring a nurse, so I had a couple interviews before I was out and a few scheduled this week. So looking forward to filling that position. And we do now have a support staff position open as well that we'll be posting for. So other than that, and the COVID question that came up already, I'm happy to talk about that if you would have any more questions on it, but we are, nationwide, statewide, everybody's seeing upticks. So the things to follow for the hospitalization data, because that's probably the most accurate.
Yeah.
To deal with.
Anything else for Rachel?
So, no, just a comment, and I think it was mentioned in the report that Bill put forward, but it's just, we've been seeing, I guess, some cases of babesia now increasing in the county and along with Lyme and anaplasma.
Yes.
And I know personally 2 cases of babesia, which is kind of unusual. It's amazing.
Yeah. So the more
Yeah.
obscure tick-borne ones are
Right.
starting to
Yeah.
increase as well.
Yeah.
Anaplasmosis.
We think COVID's coming up, but there's also these other ones that are really causing problems for people as well. And so I just want to note that.
Deb, anything?
We are also hiring, interviewing for a nurse right now, and we'll have another position open that I don't have approval to fill yet. And numbers continue to increase on our wait lists. We had a couple people that resigned as of last week, a speech therapist and a teacher. So our wait list for speech is now up to 57 kids. 4 of the kids have been waiting for almost a year for speech therapy. PT has got like 16 kids waiting. Social work has 6 kids waiting, and I have no social workers. Teachers, I have 28 kids waiting, and I only have 1 part-time teacher. The good news is we did bring in 2 new OTs with one of our agencies this month, and they took 3 kids off the OT list. I'm continuing to gather some data for Frank. When he comes back, we'll meet with him again to give him an update of where we're at.
Is that something that like IC speech students could help with?
They are helping some. They're very limited though. They have to have a licensed speech therapist work with the students, but they're taking a couple kids each month and they provide a free service for that. Some of our therapists are leaving to go set up private practice. Problem with that is the families may have to bill their own insurance or pay co-payments, or their insurance may not cover it all, where our program is no cost to the family.
Any questions for Deb?
And then I have an announcement related.
Okay.
So we're a little sad, but Debbie has submitted her retirement notice and will be leaving. This will be her last board meeting. Her last day is September 22nd. Correctly.
Congratulations.
Thank you.
Is that the position that you were needing to post or is that a different one? Okay.
That one is posted.
Okay.
So if you know a nurse that is interested in administrative and children with special needs, we are recruiting for Debbie's position currently.
Congratulations.
Thank you. It was actually a tough decision because I really do love these programs and what I do. But it's time to relax a little.
Yeah. Yeah. Thank you.
Yeah, I just want to say thank you, Deb. You were actually our intake person whenever my kid is leaving for college tomorrow. Like, right. Very sore. Yeah, and you've been incredible and had great service for the county. So thank you.
Thank you. I hope to continue to help in some way. I've offered to do some part-time work to help train the next person to it. Frank needs me to do that.
So you'll be on for another year, maybe?
No, if you retire like my parents, it's been like 4 years for each of them, but they're still working. All right, great. Anything else? And our county attorney's report, anything, Holly?
Just a quick update with regard to that CNC tobacco
matter that was the Article 78 was filed. We had submission on that and then also an oral argument before Judge Masler, Tompkins County Supreme. The two issues that were raised was one that the board's determination in finding that they violated the public health law was that the board's determination was arbitrary and capricious because it was made without review of the transcript of the hearing or any exhibits admitted at the hearing. That was an issue that Judge Masler could rule on and found that argument was without merit. The other issue that was raised in the Article 78 was that the board's determination was not supported by substantial evidence. That's actually an issue that if it remains unresolved, which Judge Masler doesn't have the ability at the Supreme Court level to rule on that issue. It has to go to the Third Department Appellate Division, which is where it's headed now. That will be handled as any other appeal before the Appellate Division. I just received last week the proposed record on appeal from the petitioner. I've reviewed it, it's complete. Obviously, this is a matter that has a very small record. So it'll just proceed as a regular appeal. She'll be filing her petitioner's brief. Once that's filed, then I will have an opportunity to file my response brief. And then the appellate division will have 5 of their justices review everything and make a determination. So that determination is several months out, but that's where we're at on that matter.
Great. Thanks, Holly. Any questions for Holly? No. Thank you. Okay, CSB report, Harmony.
We don't have, oh, excuse me, let me put my camera on. We don't have a meeting during August, so there's nothing new to report. We'll have our next meeting in September. It's usually the first Monday of the month, but it'll be the second due to the holiday in that month. The month before that, we reviewed our local services plan and approved it.
Great. Thanks. Any questions for Harmony? All right, Liz, any reports from environmental health before we move on to the enforcement actions?
Yes, I have received an email from Russ Friedel from Grassroots, who was unable to make it in person. So we're in the process of getting him the Zoom link. I remembered why I wasn't actively following the COVID wastewater sampling results. They used to give like a graph that sort of showed the trend, and now it's just the data. So you have to like remember, it takes a lot more work. So it's not easy to digest in the form that it's currently receive it in. We had a public health fellow, Nicholas Arce, the BIOS, started yesterday. So we're thrilled to have him on board. He's going to help with our public water supply program and other things as they come up. He's already very busy. And we are finishing our community block development grant for where we were providing wastewater treatment systems to income or so eligible residents in Tompkins County. That ends at the end of this month. So there's a couple of problematic, or at least one problematic system still outstanding with a homeowner contractor disagreement, I guess, that we're trying to resolve. But that'll be the end of that. It was a very successful program, and we'll be looking at seeing whether we can apply for a similar grant in the future, but we won't be having one this next year. I don't know if you want to discuss rabies. Rabies is very active right now. I think you guys probably saw press releases for kittens.
The beaver.
And the beaver, yeah. Right now it's bats.
What's very active?
Rabies, yeah, quite active. Lots of bats, a lot of Cornell students. And we're having complications because Cornell doesn't have any of the rig. So all of the cases are having to be given to CMC, either outpatient infusion or the ED, which is overwhelming them as well. So
I can comment that the problem with the rig was that the type of rig that we were getting, suddenly the manufacturing had kind of, and production had ceased, or at
It
least
was kind of a sudden thing, but
it seemed like it was relatively sudden. Yeah.
But you've switched to
Bad
a new
timing.
one and,
We're looking to switch, make
Okay.
a quick switch.
okay.
Pressure.
Until you have it in.
That I don't know.
Okay.
But it should hopefully be very soon.
good.
Sorry, that we do previous brochure also about exposure and prevention, that the very nice collaboration. between
Yeah.
Health services and environmental health. So we are working to distribute that. It takes some.
The kitten one is a little scary because people pick up kittens. Like if you saw a beaver running around, you probably wouldn't try to touch it, but
This was a shelter kitten, really SPCA situation,
Yes.
very sick kitten from the beginning, it sounded like.
Yeah, so it's quite a complicated situation, right? Since it was through the
But-
SPCA and are there other kittens? And anyway,
Yeah.
it's uncommon, right? It is uncommon that you have a rabid
Right.
kitten.
What is it, 80 or 90% of our rabies exposures are bats in the bedroom. So that's really the big area to target with messaging and communication to people that,
not beavers at the gorges.
yeah. Yeah, if you have a bat in your bedroom while you're sleeping, capture it, we can send it for testing, so we don't have to give you this big, long series of shots. Or if you're a landlord, fix your housing so that you don't even cause these exposures for students and for our community members.
Is it mainly a problem with lack of screens, or is it other types of?
They can get in a bunch of
They're like
places.
Little holes.
Yeah.
They can shrink down their little tiny bodies
Yeah.
and get in these little, yeah. So it's old housing, downtown, a lot of exposures.
And our good education and outreach, so people are aware
Right.
that they need to be concerned about bats.
Right.
Any other,
It does look like we have grassroots available.
great, should we? Sure, in 3 minutes, you said, right? Okay,
And increasing 10%.
Oh, okay, so the website's actually better than the, yeah. Yeah. I should probably look at-
okay. Hi, Grassroots, welcome. I'm glad you can join us. Hi. So this is my first time running a meeting, but you have 3 minutes to tell us what you want to tell us, and then I'll open up the floor for some questions for you, and then we're going to vote on the resolution. Okay, is that how we do it?
Later.
Later. I think that's what we're up to.
It might be next, but
It might be next. It might be in a few minutes, though. Right? You ready for us? Okay, great. I think he needs to be unmuted. Yeah.
He's double. There.
there we go.
Nope, not, it's muted again.
He needs to unmute.
Oh, yeah, he does, yeah.
There we go.
I'm Russ with the Grassroots Festival, and I'm happy to chat whenever you're ready for me. Just so you're aware, my laptop has some blown speakers, so I generally put myself on mute whenever I'm not speaking, just so the feedback doesn't come back to you.
Okay. We can hear you. You sound good. So go ahead whenever you're ready.
Oh, hey, sure. So in regards to the resolution, we just wanted to reach out and say our gratitude to Liz Cameron and Skip and the entire team at TCEH. We obviously would rather not pay the fine, but we totally are accepting of the circumstances regarding the original resolution. And we are prepared to take care of that as it pertains to the original timeline. We are sincerely apologizing for our delay in regards to that timeline, but we're very grateful to Liz and to everyone at TCH for bearing with us as we have a core staff who works all 4 of our grassroots festivals. We do 2 in North Carolina, the Shakori Hills Grassroots Festival, and this past winter, we also were doing our Miami location. So with those 2 kind of ongoing 3 times a year, really, October, March, and May, in between our 2 New York festivals, and keeping track of all that we had going on here this past year, including installing a $50,000 new water system at the fairgrounds for the campgrounds, and drainage and seepage pits, and timing everything for the weather and keeping everything going. That's how we ended up kind of falling a little bit behind on the timeline, and thus enacting this $10,000 fine that you're currently voting on and considering, which again, we are, happy to oblige by that agreement. And really, at the end of the day, we're just very grateful to Liz and Skip and Kate and Adriel and the whole team over there for, after we got over that hump, what ended up being in our view, and feels like mutual, a very good grassroots festival this year, with a permit being issued, and a productive and cordial working relationship throughout the festival, which led to overall a very safe and a very normal festival for us coming back here out of the pandemic.
Great, thanks. Thank you. Any questions for Russ? Nothing? Okay, great. Thank you, Russ. I do believe you're the next up. Because we're on to enforcements, unless I forgot anything. No? Okay, so do we vote first to approve as written, or do you fill us in first? I can't remember.
Or you have a motion, get it out for discussion.
Right, can someone make a motion to approve as written? First from Shauna, second from Ravinder.
It's on the floor.
So now it's on the floor.
For
Liz,
discussion.
any discussion for us?
So this is a stipulation agreement that we discussed, negotiated with Grassroots during the drafting of the permit application itself, right? Prior to the festival, when there were some things, especially toward the end, where they weren't quite, there were some changes, we weren't aware, we weren't involved, and that resulted in some delays and this enforcement. Overall, their application, was in a lot of it was in very good shape. And so that's part of why we decreased the penalty. We had a prior resolution in 2022 that would have fined them $20,000 for not completing their mass gathering permit 45 days in advance of the festival. They did put significant effort into it. So that was part of why we ended up in coordination with Bill Troy and their attorney and stuff in coming up with a $10,000 proposed penalty that they signed the stipulation to. I think all of the parts of the orders, right, for things that needed to be done have actually been done because they were tied to the application and festival itself. So essentially, this is now the penalty, they'll need to pay the penalty, but then the resolution will be completed. We do have a meeting set up with Grassroots for the 30th, and we'll be going over, things from this festival as well as going forward at that time.
Okay. Any questions for Liz? Any comments? Okay. All in favor of voting on the resolution as written? I think it was unanimous, correct? Okay, thank you. Thanks, Russ.
You're very
Okay,
welcome.
next resolution is Cayuga Nature Center, a motion to approve as written. First from Shauna, second from Ed. Liz, any discussion?
This one's a more complicated situation. It covers two parts, I guess, two aspects, I guess, of their children's camp. So one was that they operated a children's camp initially without a permit. They had failed to submit all of the required certifications and documents that for their staff and stuff. So, and we work with the camps on these. This was notable enough that, that we did not issue the permit, and, they told them they knew they would be getting enforcement for operating. It's disruptive to cancel a camp at the last minute. And then the other aspect is their water system, where they have a weird water system with they have a well, 2 wells, I think, up the hill, where Cayuga Nature Center is out on Route 96, 89. And then they have a cistern, we think is part of the problem, which is part of why we have the order saying what they do. But anyway, they have not, they've had water quality issues. Then we have been on a boil water order since last June of 2022. They made some changes which were not effective. I think they put in a UV disinfection system, but there was an issue. There were issues with it, never worked properly. So at this point, we are having them work with an engineer or other water professional to evaluate what are the issues with your system, take some samples from that tank, because there have been some things and other samples submitted to the lab that indicates that there is an issue with that tank that could be, that would be pushing problems down the line. So essentially, this is just try to get them to figure out what's going on with their water system, propose some corrections so that they can have an acceptable water system.
Any questions for Liz?
I have a question in regards to the certificate needed to operate. So the camp, so if someone does not have that certificate, they can choose just to pay the fine and then continue their camp?
So it's the permit to operate, right? All children's camps are required to have a permit to operate. Same with a restaurant, right? At times we'll go out and we'll find a restaurant operating without a permit, right? I'd have to check. Actually, I'm not like with a restaurant. If we have public health concerns, we can placard them. I expect that same authority is in the children's camp code, but I would need to confirm that. So, people can't, we don't control what they do, so they can operate and be subject to enforcement, right? If they got in their paperwork, we were working with them during that time, and they got in their paperwork within a week and were issued a permit for the remainder of the time. Okay, sorry, I left out that detail.
So were parents aware that they were operating without a permit?
I'm not sure of that.
Okay.
I'd have to check with what communication there was.
Okay. I think in the future, if I were a parent, I would want to know if I was sending my kid to had a permit.
Yeah, I would. I'll follow up with that, Shauna. I wouldn't be, I can't say yes, they were, but Renee Borgella is who manages our children's camps program and is very thorough and concerned about the kids as well. So I'll follow up with that.
Do they have to get a permit every year? So they know that they were supposed to do it?
Yes. Yeah. Well, and it's, the requirements they can change somewhat, there's various courses. Some of it is, not just CPR, but what's that called where you're
First aid.
First aid. Yes. All of that type of stuff. There's certifications for the camp director. So there's a lot of different it's a lot of requirements for children's camps. And sometimes they take the wrong courses, but they're close enough that we can end up getting them okay. That was not the case in this case, not the case in this situation. So they do know what's coming up, and it can be hard to comply, but they also know what they should be doing.
And if we thought it was not safe for the kids to go, we could have shut them down, or not really.
Yes, if we thought anytime we think there's a public health hazard, we could.
How does one operate a camp with having to boil water for the kids to drink?
Bottled water.
That's not good. Boil water.
Yeah,
Makes sense.
that's actually pretty easy.
Okay.
Bottled water for.
That's true. I forgot about that. Right. Yeah. I was thinking boil water over.
Yeah.
Makes sense. Sorry. Silly question.
Right.
Yeah, I should have brought it out. I forgot.
Anything else? Okay, all in favor of approving as written? Unanimous again. Anything else? Nope, I think that concludes our August meeting. Thank you.
Done.
Thanks for helping me out, everybody.
Great. C team.
B team.
Today.
But
Getting too old.
my kids, the Coddington generally